In this video, I will cover different forms of testicular tumors which are divided into germ cell and non-germ cell tumors. So for the first form, seminoma, I would like you to memorize this memory aid that I'm providing here. So fried eggs served very well in pulp seminar. So seminar goes for seminoma. Fried eggs goes for the histological appearance of these cells, which present with a central nuclei and a clear cytoplasm. Pulp goes for the increased placental alkaline phosphatase, and finally very well goes for the well response of these cells to the radiotherapy. So here would be a histological image of a seminoma where you can see we have a fried eggs appearance. So there is a central nuclei with a clear cytoplasm around it. And here we have other examples that you can see right here. And then the gross examination of these tumors, you will see that there is no necrosis or hemorrhage. The next form of testicular tumor is the embryonal carcinoma, which is a painful malignant tumor that increases HCG and alpha-fetoprotein levels. However, by itself, embryonal carcinoma never increases alpha-fetoprotein production. However, since this tumor is capable of differentiating into other forms of tumor, for instance, it can differentiate into a yolk sac tumor, then it would lead to the increased production of the alpha-fetoprotein. The next form of tumor is the yolk sac tumor, which, as I mentioned here, increases the alpha-fetoprotein production, and on histological examination is characterized by the presence of the Schiller-Duval bodies. So here is an example of the Schiller-Duval bodies that is seen with the yolk sac tumor, and it has the resemblance of the primitive glomeruli. The next form of tumor is the choriocarcinoma, and is associated with the increased hemorrhage and necrosis, either on the histological examination or on the gross examination. And then there would be increased production of the humic chorionic gonadotropin in these patients, as a consequence of which, since HCG and luteinizing hormone have a similar structure, it will lead to gynecomastia in males. So here is an example of a choriocarcinoma which presents with extensive hemorrhage and necrosis. The next type of tumor is the teratoma, and immature teratomas in males are highly malignant. So the way I memorize it is that immature males are highly malignant. And then these tumors present with elevated HCG or elevated alpha-fetoprotein production. The next type of tumors are the Leydig cell tumors, which increase the production of the androgen, and thus it causes precocious puberty in males, as well as the virilization, hirsutism, and gynecomastia. And the histological examination of these tumors show Rinke crystals. And here is an example of the Rinke crystals, which is seen with the Leydig cell tumors. The next type of tumor are the Sertoli cell tumors, and it usually causes feminization due to the increased conversion of the testosterone to estradiol. And virilization usually in this type of tumor is rare. So just keep in mind, Leydig cells causes virilization versus Sertoli cells, which causes feminization. And finally, we have the lymphoma, which is the most common testicular tumor in elderly males that usually arises from lymphoma metastasis to the testes. So lymphoma metastases. And that concludes our discussion.